Imagine two men who could be brothers. Both are in their late 60s. Both worked hard their whole lives. Both started waking up at night to urinate and assumed, that's just age. One of them kept pushing through, more coffee to stay alert, long afternoons on the couch, late dinners, and he'd put off seeing a doctor because it's nothing serious. The other made quiet, almost invisible changes. He drank water on purpose, stood up every half hour, shifted his dinner earlier, swapped his late coffee for herbal tea, and kept his annual checkups. A year later, their paths had split. One landed in urgent care with painful urinary retention. The other slept through most nights and barely thought about his bladder anymore. I'm a physician, and I've seen this story so many times that I can predict the ending by listening to the beginning. Prostate enlargement and urinary symptoms are common with age, but they are not random. Genetics and hormones set the stage. Daily choices, how you move, what you drink, the way you handle stress, decide whether the symptoms stay gentle or spiral into constant interruptions, discomfort, and avoidable complications. Today, I want to walk you through the everyday traps that quietly aggravate the prostate and the science-backed ways to ease the pressure. This isn't about perfection. It's about small, consistent steps that change the trajectory of your health. Let's start with a morning I wish more men took seriously. You wake, you're not especially thirsty, so you skip water. By lunchtime, your urine looks dark and concentrated. That concentration is a message. When the urine is too dense, it irritates the bladder lining, which sits directly above the prostate. Irritation in one often means tension in the other. Inflammation is one pathway that can worsen lower urinary tract symptoms. And while dehydration isn't the sole cause of prostate enlargement, it often magnifies urgency, burning, and that stubborn sensation of not emptying fully. The fix is unglamorous and effective. Sip water through the day rather than chugging it at night. Aim for pale yellow urine by mid-afternoon. If nocturia is your main problem, front-load your hydration earlier and taper in the evening, leaving 2 to 3 hours before bedtime without large drinks. If you take diuretics for blood pressure or an SGLT2 inhibitor for diabetes, ask your clinician whether morning dosing makes sense. Timing matters. Now picture the rest of that morning. You settle into a chair, answer emails, read the news, then you look up and realize you haven't moved in 2 hours. Prolonged sitting compresses the pelvic floor, reduces local blood flow, and can leave the muscles that help you void either too weak to assist or too tight to relax at the right moment. Large studies show that regular physical activity is linked with fewer urinary symptoms and better quality of life. You don't need a marathon. You need momentum. Stand every 30 minutes. Walk for 2 or 3 minutes. Roll your ankles. Loosen your hips. Over the week, accumulate at least 150 minutes of moderate activity and add 2 brief strength sessions. Many men are surprised to learn that pelvic floor therapy isn't just for women. Learning to relax a chronically clenched pelvic floor and then strengthen it appropriately can improve flow and reduce urgency. Your pelvis is engineered for movement. Keep it moving. I know how sacred coffee is to many of us. I enjoy it too. But it's worth understanding how caffeine behaves. It's a mild diuretic and a stimulant. In sensitive men, especially those with overactive bladder or an enlarged prostate, it can increase urgency and frequency and make it harder to sleep through the night. The research is mixed on whether caffeine causes prostate enlargement. It likely doesn't, but it can amplify symptoms in people who already have them. If your mornings involve 3 strong coffees and your afternoons include tea and cola, your bladder is on a treadmill. Keep a simple experiment. 1 cup early in the day, then switch to decaf or herbal infusions. Give it 2 weeks. Many men notice fewer nighttime awakenings and less urgency. Food is more than fuel. It's information for your body. Spicy dishes and acidic foods don't enlarge the prostate, but they can irritate the bladder and pelvic nerves, heightening the sensation of urgency and burning. If you love heat, try moderating portions and pairing spice with fiber and healthy fats to blunt the impact. The bigger dietary villain for prostate and metabolic health is the ultra-processed pattern: salty snacks, fast food, processed meats, and sugar-sweetened drinks. Diets high in refined carbohydrates, sodium, and certain saturated and trans fats are associated with more inflammation and with metabolic syndrome, a cluster that includes high blood pressure, high triglycerides, insulin resistance, and increased waist circumference. That metabolic environment is consistently linked with worse urinary symptoms and larger prostate volumes over time. The Mediterranean style, vegetables, legumes, whole grains, olive oil, nuts, fish, and modest portions of lean protein has been associated with fewer lower urinary tract symptoms and better cardiovascular health. This isn't an all or nothing pledge. Start with your next plate, half covered in colorful vegetables, a palm-sized portion of protein, and a fist of whole grains or beans. Your prostate and your arteries share the same blood supply. What helps one tends to help the other. There's another habit I see in men who are too busy to pee. You hold it. Again and again. Occasionally, the body tolerates that. As a routine, it backfires. The bladder stretches and becomes irritable. Residual urine lingers. Stagnant urine is a friend to bacteria, increasing the risk of infections that can trigger pelvic pain and worsen symptoms dramatically. If you already feel like you're not emptying well, try double voiding. Urinate, stand up, or walk a few steps, then sit back down and try again. Set gentle bathroom breaks every 3 to 4 hours while awake. If urgency hits, go. White knuckling it trains the wrong reflexes. Some exposures are simply hostile to pelvic health. Tobacco is one. Smoking and secondhand smoke increase oxidative stress and impair blood vessels, which isn't kind to the nerves and smooth muscle of the bladder or the prostate. Smoking is also linked to more severe urinary symptoms, worse erectile function, and poorer outcomes with prostate cancer when it occurs. Quitting helps at every age. Within weeks, circulation improves and inflammation markers begin to fall. If you smoke, ask about a quit plan that may include nicotine replacement, medications, and behavioral support. If you don't, stay away from secondhand smoke. Your pelvis will thank you. Now let me say something that too many men don't hear until late. Waiting until a problem is unbearable is not bravery, it's risk. An enlarged prostate, benign prostatic hyperplasia, and its symptoms often creep up gradually. Early evaluation is simple. In clinic, we use a symptom questionnaire, a physical exam that may include a digital rectal exam, a urinalysis to rule out infection or blood, and, when appropriate, a PSA blood test. Guidelines vary by country and age, and PSA screening is a shared decision based on your risks and values. But if you have symptoms, PSA is often part of a thoughtful workup. We also review medications that can worsen urinary issues, decongestants like pseudoephedrine, certain antihistamines, some antidepressants, and we adjust timing or alternatives when possible. Come in if you notice a weak stream, straining, persistent nighttime urination, blood in the urine, burning with fever, or new inability to pass urine. Early options are expansive. Lifestyle changes, pelvic floor therapy, alpha blockers that relax the prostate and bladder neck, tadalafil, which can improve both urinary symptoms and erections, and for larger prostates, medicines that shrink tissue over months. When needed, modern minimally invasive procedures can relieve obstruction with far less downtime than traditional surgery. The sooner you talk, the more choices you keep. So back at the table, there's the question of meat. You don't have to become a vegetarian to protect your prostate. However, a steady diet of large portions of red and processed meats, especially bacon, sausages, and deli meats, has been associated with more inflammation and worse urinary symptoms. High-temperature cooking creates compounds like heterocyclic amines, and processed meats carry nitrites. Neither is friendly to long-term health. Try simple swaps. Fish 2 to 3 times a week, poultry without skin, and plant proteins like beans and lentils. If you grill red meat, marinate it and cook at lower temperatures. Most of my patients feel better with red meat reduced to once or twice a week. Let's talk about the waistline. Belly fat is not just stored energy, it's biologically active. It releases inflammatory signals, affects insulin sensitivity, and alters hormone balance by converting testosterone to estrogen through an enzyme called aromatase. That cocktail is strongly associated with larger prostates and more symptoms. The mechanical pressure of a heavy abdomen also doesn't help nocturia. The good news is that the prostate responds to metabolic improvement. A 5 to 10% weight loss, achieved steadily, not with crash diets, can noticeably reduce nighttime trips and urgency. Balance your plate, cut back on sugary drinks and late-night snacking, and walk after meals. Consistency beats intensity. There's one force many men dismiss because it feels intangible: stress. The lower urinary tract is wired to your nervous system. When stress is chronic, the sympathetic fight or flight response ramps up. That raises smooth muscle tone in the prostate and bladder neck through alpha adrenergic pathways, making the channel narrower. The pelvic floor often tightens as well, blocking flow and feeding urgency. Over time, poor sleep and anxiety amplify pain, frequency, and the sense that you can never fully empty. You can reverse that circuitry. 10 slow breaths with long exhales lowers sympathetic tone. A walk in daylight resets circadian rhythms. Gentle stretches for the hips and pelvic floor unlearn clenching. Mind-body practices like Tai Chi or meditation aren't soft options. They are physiologic tools. If you're carrying heavy worries, financial, family, health, talk about them. Counseling, peer groups, faith communities, and social connection are medicine. Your bladder listens to your nervous system as much as to your diet. Let me pull these threads together in a typical day that protects your prostate. You wake and drink a glass of water. You have your coffee, 1 cup, and enjoy it. You take a short walk after breakfast. You set a quiet reminder to stand and move every 30 minutes. You choose a lunch built around vegetables, beans, and a modest portion of fish or chicken. You plan your fluids so that most are earlier in the day, and you avoid large drinks 2 to 3 hours before bed. You skip the afternoon cola and try an herbal tea. If you need a decongestant for a cold, you avoid pseudoephedrine and ask your pharmacist for a prostate-friendly option. When you feel the urge to urinate, you go. In the evening, you turn down the spice a notch if you notice it bothers you, and you keep processed meats as an occasional treat rather than a staple. You wind down with slow breathing or a warm shower to relax your pelvic floor. You sleep. And if despite all of this your symptoms persist, you make an appointment and we adjust the plan together, adding medication or specific therapy as needed. None of these steps are about perfection. They are about leverage, using physiology in your favor. Age and hormones like dihydrotestosterone are part of the story. We can't erase them. But science consistently shows that hydration, movement, diet quality, waist control, smoking cessation, medication review, and stress regulation change outcomes. They reduce nighttime awakenings, improve flow, and lower the risk of complications. They also improve heart health, blood sugar, blood pressure, and sleep. The systems are connected. If you're over 60 and hearing yourself in this, choose one change today. Fill a water bottle and finish it by noon. Walk after lunch. Swap one processed meal for a colorful plate. Move your diuretic to the morning if your doctor agrees. Put the late coffee aside for 2 weeks and see what happens. Book that checkup you've been postponing. Small decisions compound into better nights and calmer days. As your physician on the other side of the screen, my message is simple. You are not at the mercy of your prostate. Give your body the conditions to heal. If you do, the odds shift toward quieter nights, steadier days, and years, lived with confidence rather than caution. This video is for education and does not replace care from your own clinician. If you have severe pain, fever, blood in your urine, or cannot pass urine, seek medical attention promptly.